It's been nearly 2 days since the tragedy in Taunton, and the search for answers continues. New tonight, the hospital where family members say Arthur DaRosa went for help hours before police say he went on his deadly rampage is making changes. As we reported yesterday, DaRosa's family says he was released without getting the help he needed. Eyewitness News reporter Jared Pliner joins us live in Taunton with the latest developments.
Shannon, good evening. That's right. Morton Hospital says tonight, and this is a bit of breaking news, that it has banned the state subcontractor Norton Emergency Services from evaluating mass health patients who come here to the ER. The hospital claims the subcontractor failed to screen patients in a timely manner just this morning. This whole model is now at the center of this terrible story. Massachusetts Governor Charlie Baker pledging a full state probe into why Arthur DaRosa was released from Taunton's Morton Hospital hours before police say he went on a random stabbing rampage Tuesday night that left 2 dead and others injured.
We're going to investigate all aspects and every element of this.
DaRosa's family says the 28-year-old Taunton man was making suicidal statements before he was taken by ambulance to Morton Monday night. Early Tuesday, for reasons that are unclear, he was released. DaRosa's family claims the hospital treated him only for anxiety. Morton Hospital will not comment on DaRosa's treatment history, citing privacy laws, but says under state rules, an outside third-party clinician comes in to evaluate a Medicaid patient in the ER as part of a community-based emergency services program. Morton calls the ESP policy, quote, misguided, writing in part. For several years, we have asked that our hospital and others be allowed to direct these assessments independently through qualified psychiatrists, clinicians, and other medical personnel who have been subject to the hospital credentialing process, peer review process, and the policies that guide the care of every other patient, and not through an outside state contracted vendor who we do not choose. We reached out to the National Alliance on Mental Illness of Massachusetts for its take on ESPs and their effectiveness. We're told it's a mixed bag.
Hear anecdotally on our helpline that not all of the ESPs are created equally, or that someone's loved one was seen by, a very new clinician or something like that, which, could happen at an ESP. I'm sure it could happen in other places.
In comments today, the governor said no one can be released from a hospital in the Commonwealth without a joint sign-off from the hospital and the ESP, meaning someone else here at Morton had to okay DaRosa's release. Now, coming up new at 6 o'clock, we're going to take a look at the process as prescribed by law that would apply to involuntarily committing somebody for mental health treatment. We'll see you at 6 o'clock. For now, live in Taunton with the Southeastern Massachusetts Mobile Newsroom, I'm Jared Pliner, Eyewitness News.
Eyewitness News continues to track the tragedy in Taunton. As the investigation into the rampage continues, questions are being raised about the mental health of the suspect and why he was released from the hospital only hours after seeking help. New at 6, we take a look at how committing someone for psychiatric care works in Massachusetts. Eyewitness News reporter Jared Pliner is live at Morton Hospital in Taunton with more details.
Shannon, tonight we have a developing spat between Morton Hospital and the state over treatment here. The state, of course, is investigating all of this. We also wanted to look, as you mentioned, into something people have asked us about, what it takes to commit someone for treatment. Morton Hospital tonight says it has banned a state subcontractor from its emergency department, claiming just today it failed to evaluate Medicaid patients in a timely manner. This comes after Arthur DaRosa, described by his family as suicidal, spent just a few hours here before police say he went on a murderous Taunton rampage on Tuesday. It is unclear why he was released. The hospital says it has railed against the system for years in which state law directs subcontractors to evaluate patients and recommend treatment. We also wanted to take a closer look at the involuntary commitment of someone for mental health treatment. Under law, it can be done for up to 72 hours if any physician, qualified psychiatric nurse, mental health clinical specialist, qualified psychologist, or a licensed independent clinical social worker has reason to believe that failure to hospitalize such person would create a likelihood of serious harm. We reached out to the National Alliance on Mental Illness.
What we still don't know is how this person presented in the emergency department and what questions they were asked, and it's so difficult to speculate and to say, that somebody should have caught something.
We also reached out to the banned subcontractor Norton Emergency Services via the Department of Mental Health. That is who's handling all of this, and we have not yet heard back. Live in Taunton with the Southeast of Massachusetts Mobile Newsroom, I'm Jared Pleiter, Eyewitness News.
And please stay with Eyewitness News for continuing coverage of the tragedy in Taunton. A vigil will be starting in less than 1 hour. We'll have that story for you tonight on Eyewitness News at 10 over on Fox Providence and 11 right here on WDPRI 12. Plus, you can get the latest updates on WDPRI.com with the Eyewitness News app for your smartphone and by following us on Facebook and Twitter.